Hello and hi to sweet viewers of Easy Health Tips. I'm Dr. Sheen and you are watching your all-time favorite YouTube channel Easy Health Tips. Hope you all are fine and enjoying a healthy wealthy life as well. Before moving towards our today's topic, I request you to subscribe the channel and press the bell icon in order to get latest videos first of all. So, let's start our today's topic. Diabetic nephropathy, in layman's terms, is kidney damage. Individuals who are suffering from diabetes are at a risk of kidney damage, and it's referred to as diabetic nephropathy. This video will get you introduced to some of the most important matters about diabetic nephropathy, such as its causes, risk factors, symptoms, and treatment. Don't forget to share this video with your family and friends, especially those who are diagnosed with diabetes, to get to know diabetic nephropathy more. Causes: uncontrolled diabetes eventually affects the blood vessels and it can easily lead to high blood pressure. In the long run, high blood pressure is something that can damage the delicate filtering system employed by the kidneys. When the ability of the kidneys to properly filter the blood fails, certain substances that should stay in body mix with urine and then excreted. One of those substances is called albumin, which is type of proteins. The presence of albumin in the urine can be determined through urinalysis. Increasing levels of albumin in the urine is an indicator that damage to the kidneys is progressing. On the other hand, albumin levels that stay the same or decrease is a sign that the treatment given to a person with diabetic nephropathy is working. It is important for a person who has diabetic nephropathy to regularly undergo urine analysis. Now, risk factors for diabetic nephropathy. Needless to say, someone who is suffering from diabetes is at risk of diabetic nephropathy, but it's not right to say that all people who are diagnosed with diabetes are bound to end up with this kidney damage. You may have diabetes but still be able to evade diabetic nephropathy if you are successful in managing your blood pressure. As earlier mentioned, high blood pressure, a common complication of diabetes, can wreak havoc to kidneys filtering system. By keeping high blood pressure in check, the kidneys can be kept out of harms. Aside from uncontrolled high blood pressure, another risk factor for diabetic nephropathy is uncontrolled glucose level. If you have diabetes and you want to prevent diabetic nephropathy from striking, make sure that you work with your doctor in having your blood sugar levels managed. Other risk factors for diabetic nephropathy include cigarette smoking, high blood cholesterol levels, and a family history of diabetic and kidney diseases. Now, symptoms. During the early stages of diabetic nephropathy, someone who has it may not experience anything. In other words, damage to kidneys due to diabetes may not produce any symptom at all. It's for this reason why it can be hard to detect the presence of diabetic nephropathy in people who are suffering from diabetes. That is why doctors continually monitor the functioning of the kidneys to be able to spot the presence of kidney damage as soon as it appears so that it can be kept from progressing. As diabetic nephropathy progresses, as the years pass by, various symptoms will start showing up. Some of them include swelling of the arms, hands, legs, and feet due to fluid retention, shortness of breath, dark colored urine, fatigue, loss of appetite, nausea, vomiting, skin itchiness, confusion, and worsening blood pressure. Now, treatment. In treating diabetic nephropathy, it's very important to have the person's high blood pressure put under control, since it's the one that is causing damage to the kidneys filtering system. The level of glucose in the blood should be managed too. There are medications that can be given to control both high blood pressure and high blood sugar levels. Advanced cases of diabetic nephropathy usually require the person to undergo dialysis, which basically acts as a replacement for the kidneys that are no longer able to do their job. A kidney transplant is the only solution available if diabetic nephropathy has reached its final stages. Alright viewers, here we finish the topic. You can give us your precious feedback in the comment section. And don't forget to share this video with your fellows. Also subscribe the channel and hit the bell icon to show your love and support. Thank you. We'll be right back tomorrow with a new and interesting video. Till then, take care of yourself, your friends and family. Bye bye.